Okay, so initially you have a radio report of a patient who's been in a rollover MVC at highway speeds. Bystanders have called EMS. He's tachypnic and tachycardic on arrival. Oh, well, he's not here yet. Okay, but he's
On
confused
their arrival?
on their arrival.
Okay.
His skin is cool and clammy, and EMS is recommending a level 2 activation in their radio report. Okay. So, we'll go ahead. What are we going to do before the patient gets here?
Prepare the room.
What are we going to do?
Activate, have the
Level one
secretary
trauma.
activate the level 2 trauma.
Oh.
If he were a 1, but he sounds like he's gonna be, I would want vitals. You say tachypnic and
Well,
tachycardic,
I say
but-
tachypnic and tachycardic. Does that give you numbers?
No.
Okay. So what's anybody think? Level 1, level 2?
Well, it'd have to be a 2, but.
Initially at 2.
Okay.
Initially,
By
at this
criteria.
point,
Mm-hmm.
Per criteria.
Or criteria.
But I'd
Okay.
still get
highway
out
speeds.
the Belmont and like Sarah said.
Right. Okay, so Nicole, you're receiving a second EMS report. You know how they call and give you an initial report. Now they're calling. They're on their way in with him now. And they say the blood pressure is 112/84, heart rate 78, respirations are 28. Okay. Anything else you want to do at this point in time?
Glasgow.
They didn't actually give a Glasgow right now.
Okay.
Okay. But now we'll move forward, and the patient has arrived.
Oh, okay.
They walk in the door, and they do give a Glasgow now. It's 10.
Okay.
Okay. So now what happens? Patient's here. Yeah.
Like,
Oh, okay.
shuffle.
Oh,
So
and
we're gonna
Blood pressure, yeah. Scan blood pressure, go.
get the patient connected from EMS, transported on, C-spine, appropriateness,
Make sure his airway is clear.
100% oxygen. Oh, he's
He's groaning.
Brad
Um,
has got this in. I thought I was
This
hearing
is
it.
airway patent and free.
We have a patient name.
Blood and free. And
we don't have a patient name yet.
Okay, sir, how are you doing? So we're assessing his level of consciousness. We're gonna do a full.
All you get is
Okay, so not able to answer any questions, not following commands. So we would, at this point, Glasgow's going to be 8 or less. We would put upgrade to level 1 trauma. And is he maintaining his own airway?
he is at this point in time.
Okay, so we'll make sure that he does that and get some oxygen. Make sure he's get 100% oxygen on. If he can tolerate that.
did we get the level 1 and 2 order set in and call blood banking? John did that.
I did, yes I did.
Somebody will have to go
So
get this.
The order set's in.
Katie's putting in the order set, and then we will just continue with an assessment. The ER provider is in the room. If he's not, we would get him in the room.
Okay. You want to be the ER provider?
Sure.
Okay.
Oh, she does.
Where are you going to be at when you're doing your primary assessment?
I hear it had been. Hey, John gave me that says. Sir, are you alright? Can you hear me?
We just have the usual moaning sounds.
Yeah.
We have a scribe. Scribe sheet. We have a scribe.
Wait a
There,
minute.
it's grabbing right here in the corner, taking notes.
Do you have vitals?
it.
Do you have vitals yet? Are you my tech?
Fresh set of vital signs on the monitor, on some oxygen, performing an assessment, trying to get any kind of.
breathing, circulation.
Okay, well, your blood pressure now is 70/52, and your heart rate's 132.
So we've already escalated to a 1, and we've got a blood cooler now. So I would start the massive transfusion.
Okay, so hey, whoever's working at the computer, could we
Yep.
demonstrate ordering all these things?
I heard kind of diminished. diminished breath sounds on the left side. Just
Okay, left
X-ray
side's
here.
diminished.
Okay.
Okay.
Did you?
We had one large bore IV. I forgot to mention that.
I can totally get another one.
Sweet.
Ooh, can you get our blood too?
Large IV, make sure we get a typing cross.
Is the bear
Okay.
hugger on?
It is now.
Sweet. we
It's
got
been a minute since Katie started an IV, so she's unable to get the second IV.
Unable. Oh. Can you do a fem stick for the blood at least?
I can handle that. Yep, that's no problem. Do that all the time in my sleep.
Here's your kit.
Thanks.
Do you think you want central line?
I'll just put a central line. It'd be easier. Might as well.
Fantastic.
I have the time.
That's very heart-like, thank you.
Hey, when we upgraded to level 1, how did we do that? What happened?
Our secretary upgraded it to a
Okay.
level 1.
Level 1, which
They-
page is
They
the
call it
provider
communication
or the trauma doctor.
Okay, all right. So kind of what's kind of the thing you expect to hear in a little bit?
Overhead page,
The overhead page and also,
location.
well, the provider she pays is supposed to do what?
Oh,
Call back.
Call back.
Yeah. So we'd expect to hear from that in a little bit.
I put your central line in. I have your blood. Here's your blood.
Okay.
Dr. Cassidy, the trauma surgeon's on 1949.
Okay,
Dr. Wade.
and so I think John's done this a few times, so can somebody tell me where John's gonna look to find the level 1/2 order set at when he gets in there?
John doesn't know his parents.
Doing your level 1, which basically just showed this person who was not really conscious.
Right.
They were breathing on their own though, and they
Yeah.
maintained their airway so far. Secondary survey. So you were actually, I saw you listening to the lungs. You said they were diminished on the left side. Okay. I'll give you some other findings. The belly's kind of tight, kind of taut.
We need a fast
Fast
exam.
exam.
Okay.
They're here.
And they would be here
Okay.
because of the level 1
Yep.
activation.
Oh, thank you, Katie.
Got it.
Do you see any free fluid?
Do you see any fluid?
There's
Yes.
free fluid in the left posterior
black
gutter.
Where's the OR nurse?
I was like, did we call Dr. Wade? Is
We
that
have
the
a
right area?
room.
Okay. Okay. The trauma surgeon does call back, and he, secretary says, "You better take this call, Dr. Cassidy."
Hey, Dr. Wade, this is Sarah.
He goes, it's actually not Dr. Wade, it's Dr. XYZ.
Okay, well, Dr. XYZ.
Yeah.
Start with a W.
Uh,
There you go.
this sounds like something you can handle. So,
Well, I have a rigid abdomen and fast exam showing some free fluid. I really think that you need to come down and probably see him.
okay. He go, yeah, what's the point? You know, I'm busy.
I think
All
you
right.
have vision to surgery.
I think
Alright, well,
Dr.
I think we probably need to do some surgery on this guy, on this cat. Do we have somebody on backup for today?
What? What?
Dr. JFK is on backup. Should I call him?
Well, now, if you're going to make a big deal about this, I'll be down there.
Great.
Okay?
Well, that would be great. We would be glad to have you. If not, if it's an inconvenience too, we can call Dr. JFK. Whatever she says.
Oh, no, I'll be, you know, I just got to clean this up in the office. I'll be there in a few minutes.
Say CAT scan. We can go to CAT scan if Dr. Wade or Dr. XYZ is not here yet.
What conditions should be present when we make that decision to go to CAT scan?
The physician will have to go with us because this patient is unstable.
Okay, yeah. Do we want to go to CAT? Okay, well, let's do a little debriefing around this scenario that we've got here. So, initially, when that first EMS call came in, did we actually have level 1 criteria?
No.
No, we didn't have the numbers. It's
Yeah.
real narrow criteria,
Sure.
you know. That's the way the trauma surgeons like it, but we didn't have it. basically, when did you think like we actually met the level 1 criteria?
With the Glasgow probably.
Yeah,
On arrival.
yeah. And definitely when we got
The blood pressure.
the blood pressure, yeah. So that single blood pressure less than 90, right?
Right.
Okay. Can you think of some other level 1 criteria?
Penetrating injury
Respiratory rate over 30,
Right.
or less than 10.
Okay.
less than 10.
Okay.
GCS
Cap
of
refill on kids
3.
of over 2 seconds.
Right. Excellent. Excellent.
And Glasgow.
Penetrating head, neck, or
Yeah.
torso.
From
Yeah,
here to
from
here.
here,
Right. Okay. There's something about bleeding
Uncontrolled bleeding or tourniquet.
or a
device.
tourniquet. Yeah. Or if they were Watt to control their airway and breathing.
Innovative.
Innovative. Yeah, it's pretty narrow criteria, but that's basically what it is. We didn't necessarily get into on this one how we make a decision around level 2s to go with them to imaging. But do you remember what that is?
Timeout.
The timeout.
Time out with the provider.
Yeah. And what's that consist of?
Condition, the two, discussing the patient's condition and risks of decompensating, essentially.
Right. So it's a little situational awareness piece. It's like a cognitive checkpoint. And we call it the timeout, but it just means that you talk to the provider and say, what do you think? They're going to say, well, I don't know. What do you think? You know, but you have this cognitive timeout is what it amounts to. And then you're documenting that where?
And
In the trauma details.
Trauma details. It's now at the top of the trauma details form. And it should occur before you do
leave the department.
leave the department. So what it's timed for before you actually go anywhere. Okay, and then the rest of it is the trauma pre-registration. We used a trauma pre-registration on this patient, right? Because why did we do the trauma pre-reg?
So we could get orders in.
Right. You want to get some orders in. And what's the big order you want to get in on a patient?
The massive transfer.
Massive transfusion. That's the main reason for doing it. And who does that for us? Who does trauma pre-reg?
Access representatives.
Access reps, right. So they're going to create this ID band, which they have a list of pre-reg names they use. It's military designations. And let's say today they use Trauma Echo, okay? And they give you the ID band, you put that on the patient when they get here, and then they try to update it with actual patient information as soon as they can, right? So, and if they do it right, they just update Trauma Echo. And then they bring in another ID band, which has got the actual name and date of birth on it. What do you do with that ID band?
You leave it on.
Add it.
Make
Yep,
sure
you
the
make
encounters
sure
are
they're both
matched.
on,
Right.
the encounters are the same.
Right. Encounters match and they both go on. And then we talked about the level 2 activation order set. What's the point of using that?
No missed injuries.
Yeah. No missed injuries, and actually I don't really find missed injuries so much as this whole business about, well, let's get a CT of the head and neck now. Then an hour later, well, let's do a CT of the belly and the pelvis.
Or
Expedite.
you need your creatinine.
Yeah. So it just kind of
Your pregnancy.
gets everything done a little bit more in timely fashion. When you had that trauma surgeon on the phone, Dr. Cassidy, and the trauma surgeon was not exactly responsive, okay? What do we call that kind of communication you do where you give them the situation, the background?
That would be your S-bar.
Okay.
Yep.
So it's a very concise form of communicating, maybe around handoffs, maybe around a situation, and we had a situation. What was the escalation maneuver that you were going to use if he did not show up?
I was gonna use the backup trauma call.
Okay.
And then if I needed to, I could even continue to the trauma director
Right.
essentially, so.
Yes. Which would be Dr. Wade,
Yep.
who will, if he's available, he'll just about always respond, or he'll get on the phone to somebody who will
Who
respond.
will, yeah.
Okay, so, all right, very good. What other thoughts do you guys have about this particular scenario?
That's good.
It was good.
We saved him.
We did save him. That's
We
the
made-
important
so
part.
Dr. XYZ comes.
Yep.
I got my first chest tube. No,
All
I'm
right.
just kidding.
Okay, very good.